If you're planning to enroll in Medicare this year, stop scrolling right now because the rules have changed. 2025 isn't just another enrollment season. It's the year of major Medicare reform. The government has quietly rolled out updates that could save you thousands of dollars or cost you even more if you miss them. From new prescription drug price limits to premium adjustments, from expanded telehealth coverage to tighter enrollment deadlines, the fine print this year matters more than ever. And here's the catch. Most people won't even realize how these changes affect them until it's too late. That's why, in the next few minutes, I'm going to break down everything you must know before you enroll in simple, clear, and practical language so you can protect your health coverage and your wallet. Because one small mistake in your Medicare enrollment could lock you into higher costs for the entire year. Hey everyone, welcome back to the channel. If you're new here, I'm Invest Harbor, and on this channel, we talk about smart financial planning, healthcare updates, and ways to make your retirement stronger and stress-free. Today's video is one of the most important we've ever done because Medicare in 2025 looks very different from what it did even a year ago. Premiums have shifted, new out-of-pocket caps are being introduced, and there are updates that directly impact millions of Americans, especially those turning 65, retirees, and anyone helping their parents choose coverage. Whether you're enrolling for the first time or reviewing your current plan, this video will help you understand exactly what's new, what's changing, and what actions you should take right now to avoid penalties and maximize your benefits. So here's what we'll cover together today. First, we'll look at the key 2025 changes in Medicare premiums, deductibles, and out-of-pocket costs. Then we'll dive into the new prescription drug reforms that could make your medications cheaper. After that, we'll explore the expanded coverage options, including telehealth and preventive care benefits that are new this year. I'll also show you the biggest enrollment mistakes people make and how to avoid them. And finally, I'll give you a simple checklist to help you choose the best plan for your situation in 2025. By the end of this video, you'll not only understand the updates, but also know how to make them work in your favor. So stay with me until the end, because this year's Medicare changes are not just about coverage. They're about control, confidence, and making sure your healthcare choices actually serve you. Let's start with what most people notice first: the cost. Medicare 2025 has introduced several key adjustments in premiums and deductibles that you need to know about before enrolling. Part B premiums, which cover doctor visits and outpatient services, have increased slightly compared to 2024, averaging around $179 per month for most beneficiaries. Part A, which includes hospital stays, remains premium-free for most people, but its deductible has gone up by about $40. These changes might not sound huge, but over the course of a year, they add up. The good news? The increase in Social Security's cost of living adjustment may help offset some of these costs. But it's still essential to review your plan carefully, because higher income earners could see additional surcharges under the IRMA rules. Also, check your Medigap or Advantage plan. Many private insurers adjust their premiums annually. Remember, don't just renew your existing plan blindly. Take a few minutes to compare your current costs with the updated 2025 numbers. Those few minutes could easily save you hundreds of dollars this year, especially if you're managing multiple prescriptions or frequent doctor visits. One of the biggest Medicare updates for 2025, and perhaps the most anticipated, is the new out-of-pocket spending cap for prescription drugs. For the first time in history, Medicare Part D will include a $2,000 annual limit on what beneficiaries have to pay out of pocket for medications. Once you reach that limit, Medicare covers the rest for the remainder of the year. This is a massive relief for millions of seniors who struggle with high drug costs. The Inflation Reduction Act is also kicking in new drug price negotiations for more name-brand medications, expanding beyond the initial 10 drugs selected last year. This means lower negotiated prices for chronic condition treatments like insulin, heart disease, and arthritis medications. Speaking of insulin, its monthly cost remains capped at $35 under Medicare. So, if you're taking long-term prescriptions, 2025 is the year to review your plan's drug list or formulary carefully. Not all plans include the same negotiated drugs, and switching to one that does could save you hundreds or even thousands per year. Make sure to log into Medicare.gov and check which plans cover your medications at the lowest total cost. Medicare 2025 isn't just about prices, it's also about better access. This year, Medicare is expanding benefits to include more services that modern healthcare now relies on. For example, telehealth, which became popular during the pandemic, will continue to be fully covered for primary care and mental health visits, even for patients in urban areas. That's a huge advantage for people who prefer convenience or live far from major hospitals. There's also expanded coverage for preventive services like free annual wellness exams, vaccinations, and screenings for common conditions like diabetes, cancer, and heart disease. In addition, some Medicare Advantage plans are now including hearing aid support and transportation benefits, which were previously limited. These updates reflect a larger shift. Medicare is moving toward preventive care instead of just reactive care. The goal is to catch health problems early, keep you out of the hospital, and reduce long-term costs. So, when you review your 2025 plan, don't just look at the premiums, look closely at the benefits section. A slightly higher monthly cost may actually give you far more value if it includes extra services you use regularly, like telehealth, vision, or dental coverage. Now let's talk about something people often overlook: deadlines. Missing Medicare enrollment dates can lead to costly penalties and coverage gaps. For 2025, the initial enrollment period still begins 3 months before your 65th birthday and ends 3 months after. If you miss that window, you'll have to wait until the general enrollment period, which runs from January 1st to March 31st, and your coverage won't start until July. There's also the annual open enrollment period, from October 15th to December 7th, when you can review and change your plan for the next year. Missing this period could mean being stuck with a plan that no longer fits your needs or budget. Here is a common mistake: assuming that your plan from last year automatically gives you the best value this year. Plans change, drug coverage, provider networks, even premiums can shift. Another big mistake is delaying enrollment because you think you still covered under an employer plan when you not. So, set reminders, check your eligibility dates, and reevaluate your coverage every year. One small oversight in timing can lead to lifelong premium penalties or months without coverage, and that is something no one wants to deal with. Finally, let's talk about choosing the right plan, because this step determines everything that follows. In 2025, you'll generally be deciding between Original Medicare and a Medicare Advantage, Part C plan. Original Medicare gives you the freedom to see any doctor who accepts Medicare, while Advantage plans often come with lower premiums and added benefits like vision, dental, or gym memberships. But here's the key: not every plan is right for everyone. If you travel often or live in multiple states, Original Medicare might offer more flexibility. If you prefer a managed system with extras, Advantage could be better. Just make sure your doctors and medications are included in the Plan's network and formulary before enrolling. Use the Medicare Plan Finder tool on Medicare. It's free and updated for 2025. Compare total annual costs, not just monthly premiums. And if you're unsure, consult a SHIP counselor, State Health Insurance Assistance Program, for free, unbiased help. Choosing your 2025 plan isn't just about health coverage, it's about peace of mind. The right plan can save you stress, money, and countless hours of confusion throughout the year. Take your time, review carefully, and enroll confidently. So, to quickly recap, 2025 brings some of the most significant Medicare updates in years. From changes in premiums and deductibles to the historic prescription drug out-of-pocket cap, and from expanded telehealth and preventive benefits to the enrollment deadlines you can afford to miss. Knowing these updates is absolutely critical. The choices you make now will affect your healthcare coverage, your out-of-pocket costs, and even your peace of mind for the entire year. Remember, don't just stick with last year's plan without reviewing it carefully. Compare your options, check drug formularies, confirm your provider network, and consider all the new benefits available. Whether you're enrolling for the first time or switching plans, these steps could save you hundreds or even thousands of dollars while giving you better access to care. If this video helped you understand the Medicare 2025 updates and gave you a clear path to make smarter decisions, make sure to hit the like button and share it with someone who is turning 65 this year or planning their enrollment. And don't forget to subscribe for more updates that protect your money and your health. Take control of your Medicare choices today, enroll wisely, and make 2025 the year you get the coverage you truly deserve.